Toronto Cardiac Tumor Conference is something that I conceived and developed about 8 or 9 years ago. And what we've done is we've taken the world's experts on different types of tumors in the heart and different aspects of tumors of the heart and had those international experts. They really are the international experts meeting on a once-a-year basis on different topics every year to discuss these projects. So instead of having a textbook that's published, that's limited only to those people that can buy the textbook or know about the textbook, this is an online textbook, so to speak, that's current and given by the world's experts on these topics. It's free for everybody to join. So it's really a worldwide resource that's free for everybody who has internet to get into and learn about these tumors. So that was the concept behind the Toronto Cardiac Tumor Conference. It's done once a year in January. The Interact project is another project that came out of that. And when you look at cardiac tumors, they're so rare that, for instance, in a 30-year period, they found 400 cases in the United States, a country of 200 million people or 300 million people. They're so rare that you can't even begin to determine what the best treatment modalities are for these people. Forget about the molecular basis and trying to identify what these tumors are, even just to get enough people in a short time period. Remember, these studies are over tens of and decades of research. So what we want to do is have the whole world together, and we've gotten cardiologists, radiologists, pathologists, surgeons from every continent. And what we're going to do is have the continental leaders collaborate with people within their own continents and get the data together. It's a light data set. For instance, it's not an onerous data set for people to partake in. And the concept there is that it won't be hard to do. It's global. We will determine where the global centers of excellence are by determining where most of these tumors are being seen and operated upon and treated. And so we will be able to identify by the registry where the areas of excellence are. For instance, I, in Toronto, in Canada, will get emails from somebody in, for instance, Pakistan or South America or something, talking to me about a member of their family who has a tumor. And it'd be really nice to know, well, you're in Pakistan. We know in that part of the world, there's this institution that is a top-notch institution, or at least an area that sees a lot of these types of tumors. That's one of the concepts of making an international registry like this, is to identify the areas of excellence in the silos around the world in patients, in places that deal with these tumors. And also it's an opportunity for international collaboration amongst those experts that want to get together to study these tumors. And finally, it's an opportunity for different centers to collaborate in addition and over and above discussions regarding cardiac tumors. So it's a way to bring everybody together. And it's going to be a way to bring everybody together, not only from a geological point of view, but also from a geopolitical point of view as well. Because there really is no politics in person who's trying to help another person get over a tumor, or an institution helping another institution with a problem with a patient with a tumor. So it's going to have multiple faceted levels of help for those people around the world. So that's what the Interact project is, and that's what the Toronto Cardiac Tumor Conference is all about.